Therapeutics publishes the results for a phase 1 trial in CTX110, which is a CAR T allogenic cell therapy. So we're taking cells from healthy people, T cells, we reprogram them, put them in a cancer patient, and hope that those T cells kill the cancer. The results are, I think, interesting for two reasons. One is we can learn of how biotech works here in terms of reactions of the market and what we should expect and all those types of things. And second, I think it's also important just to go through the basic scientific facts here and try to learn also. We're in the progress here of finding a cure for cancer. And let's not forget, I mean, we're in the whole wealth generation business here, but we're also in the business, particularly at Orange Capital Partners, of actually helping people survive. And I think we should just keep touch with that. This is not even on podcast. It's October 12th, 2021. This is Crim Delco. This is the second episode of today. We have a little bit of a change from the last update. So for the day, we're up 2.4%. The market's down 20 basis points. For the year, we are up 11.4%. The market is up 15.3%. We're underperforming by 3.9%. So after the close today, Crispr Therapeutics published the phase 1 data of one of their CAR T cell therapy trials. It's CTX110, and it doesn't really matter what the names here are. I want to keep it relative. I want to try to keep it pretty big picture here in a sense that the purpose of this podcast is to give people a sense of what it feels like to run a hedge fund. So, of course, I'm not going to talk about the details now of CAR T cell therapy, but let's keep it big picture. So we have the ability to use the human immune system to fight cancer. This is the idea. Immunotherapy has been around for about 100 years. It's had its ups and downs. About 10 years ago, it had a pretty big renaissance with what's called autologous cell therapy, when you take T cells from patients, reprogram them, put them back in the patient. And companies like Kite Pharmaceuticals and others have pioneered that space, have done pretty well. The companies got sold, Kite got sold to Gilead, and have been doing pretty well in the last 10 years. We have now a disruptive force, which is called allogenic cell therapy, where you take third-party cell therapy, cells, reprogram them, and put them in the cancer patients. What needs to be done is in primarily two things. One, you have to program the cell such that it actually attacks the cancer, and B, you have to make sure that the immune system of the patient doesn't reject or even that we have an infection, in a sense that the cytokine storm or something like that, where the patient could be severely impaired by the infectious or toxic response to the T cells that are injected. So those are the two things that we have to program the cells for. Now, programming cells is a technology in itself which has evolved, and it had several aspects to it. And most recently, we are now able to use CRISPR technology to do that, which is we're basically changing the DNA of the cells so they produce particular proteins, which then yield to the desired results. This is in a nutshell what allogenic cell therapy is. Now, the reason the CRISPR companies are jumping on that bandwagon is for two reasons. One is they have the tools to rewrite the DNA. They simply have the tools, and therefore they have the ability to do it. But more importantly, I think the key to success here is what's called multiplex editing, because we have to be able to do many, many trials and errors here before we get to really good results. That's just simply the way it works in science in general, particularly when the science goes from scientific progress to engineering progress, and this is where we are here. So now let's get to the data. I think what happened here today is that we got some data. The data is good in a sense that it shows efficacy and it shows safety. The stock has been down after market about 8%. And I think the reason the stock is down is because we haven't seen really, like, how do you say, knocked out of the park type efficacy. The efficacy is in line with what the autologous cell therapies are showing. So, which means that we have good data. It's definitely good. And let's not forget, if you have in this particular trial, have 24 patients, half of the patients showed good results, and about a third of the patients showed almost, at least we could hope that they could be cured. So this is, of course, amazing. This is to cheer for. Now, why is the stock down? Well, because we're in the money making business here too. And the problem is that the efficacy is, this is my interpretation now, the efficacy is good, but it's not that great. And the question always with these things is, how much will they be able to charge? If you had 100% efficacy, if everybody gets cured here, if we have like just a, the penicillin of cancer, it's working. It's no question. We're going to jump we're not going to do any beta A/B testing anymore. No prophylactic, no nothing. We're just going to put everybody on this drug because it works so amazing. Then of course the stock will be double, triple, whatever, because we're talking about a massive market, which is the cancer market, and the potential to cure cancer with this particular drug, or at least specific types of cancer. But we're not seeing that kind of efficacy. What we're seeing is okay efficacy. Is great. Again, every life we can save, every life we can extend is great. But how much can we be charged? How much will society pay for these types of treatments? This is the big question. Now, I think it's absolutely out of question that this company, Crispr Tx, should be compensated for their effort. But how much, and how much profit, and how much market cap, and how much shareholders get, all these things are up in the air. We're not clear because the efficacy is not as mind-blowing as maybe it could be. Now, having said that, of course, we expect actually the stock to do well in the midterm. Maybe tomorrow it will. Actually, we even expect it tomorrow to trade up because the data is good and the safety is good. That's important. We have good safety data, which has been particularly since last Friday, when Allogene Therapeutics showed some problems with their safety. They're using talons and different types of technologies to edit their genes. But we had some issues there. Here we don't have those issues. So that's good news, and that should give the allogenic cell therapy space a little bit of a breather. I think we're not ready yet to make the claim that CRISPR technology is safer than talent, and therefore whatever problems we used to have with gene editing technologies are going to be mitigated with CRISPR technologies. We're not there yet, by no means. And I just want to reiterate my comments that I made as a response to the Allogene Therapeutics problems. And this is the following. Here in Orange Capital Partners, we have chosen to invest in biotech and CRISPR because we believe that this technology, particularly the CRISPR revolution and what base editing and prime editing are offering, and the Chardonnay technology by Caribou, and all these new developments, and the ones which will come, no doubt, what they're doing is they're enabling a faster try and error process. And this is the only way we're going to go after these diseases. This is the only way we're going to generate wealth with this. So biotech is going from a bespoke, idiosyncratic, scientific, sort of alchemist type space, type sector, into a more engineering driven, more deterministic, more we're here, we're going to get there type of discipline. And that is when the rubber hits the road as far as wealth generation is concerned. But scientific achievements, scientific breakthroughs, ideas, creativity that is coming out of the lab, when it gets into the engineering space, and when the creativity there, which is very different type of creativity, which is a lot about exploring counterfactuals, figuring out what works, what doesn't, try and error correction. When those things kicking, and when we have technologies such as particularly multiplex gene editing, or what Caribou is doing, which is sort of a massive parallel gene editing technology, then we have the ability to try many things and see how they work. For example, also we could have multiple gene edits to see that what kind of effects that could have on let's say, in particular CAR T cell therapy. So to cut a long story short here, what I'm trying to say here is that we are incredibly confident with our investment in the biotech space because we are at the cusp of turning life science from a bespoke idiosyncratic discipline into an engineering driven discipline with clear goals and deterministic outcomes and things that are predictable in a sense that we can say, as long as you tell me that the cost of iteration are going to come down, I can then tell you that we will get results faster and at lower cost. In particular, allogenic cell therapy is uh, interesting because it allows for higher speed and lower cost. And cost is a big deal because I just said in this particular episode, I said one of the problems with the CRISPR therapeutic stock is we don't know how much they're going to be able to charge. So if they can lower the cost of their process and manufacturing and R&D, then of course they can also charge less, and the less they charge, the higher the take rate will be, and therefore we will have this nice flywheel of higher take rates, higher sales, higher profits, higher R&D expenses, higher result, higher efficacy, higher better results, better solutions, even better solutions, and so on and so forth. This is the idea. We are, as I said, at the cusp of this process. We're not 100% there. I wouldn't say we're there. We can't say we are there. So if we take the analogy, let's say, of IT companies, of computer software and things like that, when we were, let's say, in the 60s and 70s, there was still a lot of crude software development, IT development, and all those sort of things. And the iteration was very expensive. You needed hardware, you needed software. It was expensive. And today we are in a much faster iteration environment. That's why we have this immense wealth generation in Silicon Valley. We hope that we can get there with biotech, and we hope it's not going to take 40 years. Maybe we can get there in 10 years. And like I said in the notes on biotech investing, of course, one of the big question is, are we too early? And the answer is no, we're not too early, because we believe that if within 10 years we can have trillion-dollar market caps within biotech, then certainly we're not too early right now. Thank you.